Shifting focus now to what's happening in China. The country is battling a new COVID-19 wave. That's right. Just 3 months after infecting thousands, the Wuhan virus has now made a comeback in China. And if we believe the experts, the new outbreak may be the greatest wave of illness that the country has ever recorded. And this, of course, forced us to ask the obvious questions. Should the rest of us be worried? What really is going on? Let me just start off with the numbers. Beijing's health authorities say that COVID-19 cases in the city this week topped 25,000. They say that this is the largest number of weekly cases in recent months. In fact, the spike is so big that a Bloomberg report says the new wave could lead to 40 million weekly cases by the end of May and 65 million weekly cases by the end of June. I repeat, 65 million. It's a startling prediction, especially for China, where the pandemic originated in 2019, remember, and which only months ago had enforced some of the harshest COVID-19 protocols in the world. And now with the latest Omicron subvariant fueling a resurgence in the cases, China is expected to go back to square one. So which subvariant is behind this surge is the question? Well, there's not one variant this time. It's a concoction of mutations. The names of 3 of them stand out. XBB.1.91, XBB.1.9.1, XBB.1.5, XBB.1.16. And these 3 subvariants are driving the spike. So just how serious is this spike? Well, according to experts, the new wave will be less severe than the previous one, but public health experts believe that to avoid another surge in the mortality figures, especially among the elderly population of China, a vigorous booster program and a ready supply of antivirals in hospitals is essential. Let me just quote a statement from an expert at the University of Hong Kong School of Public Health. He says, and I'm quoting, "The number of infections will be less, the severe cases will certainly be less, and deaths will be less, but that could still be a large number. Even when we think this is a milder wave, it could still be quite a substantial health impact on the community." And then we have the Beijing Center for Disease Control and Prevention. It says the variations have increased the number of cases since last month, with COVID-19 surpassing flu as the most prevalent infectious disease, especially in the final 2 weeks of April. And besides Beijing, the situation is difficult to grasp in other parts of the country. And that is because China has stopped releasing domestic infection data after April. In fact, even restrictions similar to those that existed during the zero COVID era, when China tried to stop any illnesses, have not been reinstated yet. And the majority of citizens seem to be going about their daily lives as usual. What about vaccines? Well, China has new COVID-19 vaccines in the pipeline, which will specifically target XBB variants. The country's drug regulator has given preliminary approval to 2 vaccines so far. Remember, during China's first Omicron wave in December and January, a different Omicron variant was infecting millions of people every day. It overwhelmed the hospitals and crematoriums in cities across the country. Store shelves were emptied. As far as fever medications are concerned, schools were shut down. Some estimates say that about 80% of China's 1.4 billion people were infected during that wave. But immunity may have waned in the months since, raising the risk of reinfection. So just to put this simply, this wave may not really be severe, but it can still end up burdening the health authorities, and not to mention the fear that these cases may spill over, because if the last 4 years have taught us anything, it is this: what happens in China does not really stay in China. WION now available in your country. Download the app now. Get all the updates on the move.